Okay, let's dive right into this. Welcome to This Explainer. Today we're exploring the physics of healing, electric fields, and electrode placement. Now, if you're a first-year physical therapy student, you're about to embark on this honestly incredible journey into the actual mechanics of recovery. And you're probably looking for a really clear, direct understanding of the tools you'll be using every day. So we're going to uncover exactly how invisible physics directly influences the physical therapy you'll be providing to your future patients. We so often think of healing purely in terms of anatomy, right? Like muscles, bones, tendons. But to truly master electrotherapy, we absolutely have to master the physics behind it. We have to understand the canvas of electric fields and exactly how to place our electrodes to paint the right clinical picture.
So it's a pretty fascinating question, isn't it? How do invisible forces actually heal? Think about it for a second. When you look at a patient, you see their physical form. You don't see the electrical currents flowing through their tissues. But as a clinician, your entire job is to harness those very invisible forces to create a tangible biological change. We're going on a journey today that takes you from working with the invisible to becoming, well, clinically invincible. Because if you deeply understand the physics we're about to discuss, you literally stop guessing where to put the pads and you start knowing. You completely transform an invisible mystery into an incredibly precise medical tool. To get there, we really need to start at the absolute foundation. An electric field is simply a region around a charge in which another charge experiences a force. Think of it kind of like a zone of influence. Imagine you're holding a really powerful magnet right under a wooden table, and there's a paperclip just resting on top. As you move the magnet around, the paperclip moves right along with it, right? The magnet has this magnetic zone of influence, and the paperclip is caught inside it. Well, an electric field operates exactly like that. It's an invisible sphere of influence where one charged particle can reach out across space and push or pull on another charged particle. If a tissue cell or, say, a nerve fiber is sitting inside that zone, it is absolutely going to feel that force. But hey, talking about invisible zones is, well, it's highly abstract. And in therapy, we need to be practical. We need a way to actually visualize the invisible. And that brings us to lines of force. Imagine a flowing river. You can't necessarily see the abstract concept of flow itself. But if you drop a handful of autumn leaves into the water, you immediately see the lines of the current. You vividly see where the water rushes quickly over submerged rocks and where it sort of eddies softly near the grassy bank. Lines of force are basically the leaves in our electrical river. They're a visual representation that physicists and physical therapists use to map out exactly how that invisible zone of influence is behaving. And here's a fun fact. Since the human body is about 60% water and absolutely packed full of conductive electrolytes, we are quite literally the perfect riverbed for these currents. Let's look at how these electrical rivers actually flow. Now, these lines of force aren't just random. They don't do whatever they want. They follow very strict rules of physics, acting like a precisely mapped out stream. First up, they always originate on a positive charge and terminate on a negative charge. Going back to our river analogy, the positive charge is the mountain spring pushing the fresh water out, and the negative charge is the ocean pulling the water in. The flow is always directional. Second, they never intersect. No way! You will never see two field lines cross each other and crash. They always find this really harmonious parallel-like path. Third, they're denser where the field is strong. Think of river rapids. Where the water is forced through a narrow, dense space, the current is incredibly powerful. And fourth, they're always perpendicular to conductor surfaces. So when the electrical current leaves your electrode pad, it steps off at a perfect 90-degree angle before it even begins to curve towards its final destination. To put this into perspective, think about a uniform field created by parallel plates. Imagine a perfectly engineered canal. The water flows from one side to the other in these smooth, straight, perfectly evenly spaced lines. The strength of the field is exactly the same everywhere between those plates, providing a very, very consistent experience. But now contrast that with a non-uniform field created by point charges. This is much more like dropping a pebble into a totally calm pond. The lines just ripple out, curving and bowing in these beautiful geometric arcs. The lines are packed super tightly right next to the charge, creating high-density, rapid water, and then they spread out widely as they get further away, resulting in low-density, really calm water. And that brings us to a golden rule. This is what shifts us out of the physics lab and directly into your clinic. Field lines determine current spread. When you're applying galvanic or ferritic currents to a patient's tissue, those currents aren't just magically jumping from pad A to pad B through thin air. Not at all. They are traveling exactly along these electric lines of force. The shape of the field totally dictates the exact spread of the current through the targeted muscles and nerves. The geometry of your electrode placement literally shapes the invisible river of healing energy inside your patient's body. You, less you, are the architect of that river. Which brings us to something absolutely crucial, an unbelievably important equation.
Field density equals patient safety. Remember that third rule from just a few moments ago? Field lines are denser where the field is strong. If you create a setup where the electric field lines bunch up and become extremely dense in one tiny little spot on the patient's skin, well, that specific spot is going to receive a massive, concentrated dose of electrical force. In our river analogy, you've just created violent, incredibly dangerous rapids. In the clinic, a highly dense field translates to a really painful, biting sensation for the patient and potentially even severe tissue burns. Managing field density by understanding the behavior of these lines is exactly how you keep your patient perfectly safe and totally comfortable while delivering highly effective therapy. So how do you actually control that density in your day-to-day practice? Well, it really comes down to a simple three-step clinical thought process. Step 1, you alter the electrode spacing. If you place the pads very close together, the field line stays superficial and really densely packed between them. If you move the pads further apart, the lines dive much deeper into the tissue and spread out into a much wider arc. Step 2, because you altered the spacing, you have successfully changed the current density. You've actively manipulated that field gradient. Step 3, that change in density directly impacts your treatment outcome, whether your target is pain modulation or muscle stimulation. A deep, diffuse field might be absolutely perfect for stimulating a large muscle group like the quads, while a really concentrated superficial field might be tailored for specific, localized pain gating in a joint. Understanding this specific sequence just vastly improves your therapeutic precision.
Wow, we have covered a tremendous amount of ground today. We took the totally abstracted definition of an electric field, we visualized it as a flowing river of force lines, we learned the rigid rules that govern their path, and most importantly, we connected those physics directly to clinical safety and your treatment effectiveness. You basically have a kind of X-ray vision now. When you look at your future patients, you won't just see skin and bone anymore. You're going to envision the positive and negative terminals, you'll vividly see the lines of force curving through the tissue, and you'll implicitly understand exactly where the current is dense and where it is weak. So I want to leave you with this final thought for your practice. Now that you can actually see the lines in your mind's eye, where will you place the pads? Thank you so much for exploring this totally fascinating topic with me. Keep learning, keep visualizing, and I'll catch you on the next explainer.